we're going to do the respiratory examination. I have performed hand hygiene, I've gathered all my equipment, and I'm going to enter the patient's room. Can you tell me your name and your date of birth?
Philip McCarter, 4/19/1991.
And this matches up with his wristband and my records. So first I'm going to just do a general overall appearance assessment. I'm going to be inspecting that. I'm looking for any evidence of respiratory distress, and I'm also observing the rate and rhythm of the patient. I'm looking for any cyanosis, and I am seeing, and I'm also looking for any deviation in the trachea. I'm just inspecting that. And now I'm going to listen to the patient for any audible wheezing, and he does not appear to be wheezing. I don't hear anything. I'm also looking for accessory muscles and looking for any retraction, and I don't notice any retraction in the breathing. I do notice a little divot right here in the this area right here. And now I'm just going to be comparing the anterior and posterior diameter, and we're looking for any barrel chest, and I don't notice any barrel chest. And I'm also inspecting at the lateral position. I'm inspecting for symmetry. And so now we're going to palpate the areas, and we're going to be looking for any tenderness, and we're going to test for expansion and tactile primitus. So I'm just going to palpate, and I'm palpating for any crepitus, any air bubbles, any tenderness or discomfort the patient might be in. And now I'm going to test for chest expansion. I think I'll leave that to the posterior side so we can get a better view. But I'm going to go ahead and percuss the chest wall here, and I'm looking for resonance. And I want to be sure that I don't get on the sternum. I'm on the lift here. Okay, you can place that back down. And now I'm going to just auscultate and listen. Also check up here. And here I'm listening for any adventitious breath sounds, and I don't notice any. So now we're going to go on and go to the posterior aspect of the respiratory examination. I'm just going to ask the patient to, if you don't mind, to turn around so I can see your back. Again, I'm looking for any respiratory distress. I'm looking for any bruising. I'm looking for the color, looking for any cyanosis, and I'm looking also for any wheezing, and we didn't notice that in the anterior aspect of the examination. And so now I'm just going to palpate some areas. And again, I'm looking for any tenderness, and I'm going to test for chest excursion. And we're just going to have the patient to chest expansion. That's what we're doing right now, is checking for chest expansion, not excursion just yet. So I'm just going to place my hands right here, and I'm going to ask the patient to, I'm going to get some skin right there. You can't see that. And I'm going to ask the patient to just take a deep breath in and exhale. And I'm just looking for symmetry and making sure that is equal for the chest expansion. And now I'm going to check for tactile fremitus, and I'm just going to ask the patient to say the words 99. I should have done this on the anterior aspect of the examination, but I'm just going to ask the patient to say 99, please. Can you say
99?
And everywhere I hit, you feel my hands touch, if you would just say 99.
99. 99. 99. 99. 99.
Okay, and there I was just checking for the vibrations to make sure that I felt those vibrations. And now we're going to percuss both sides of the chest. And we're looking again for resonance. Okay, and here I hit dullness, and so so I just mark that here, and let me see if I can find the dullness on this one. Okay, so we have about the same side of dullness right here, and then I'm just going to ask the patient to, let's see. Now this would be for excursion, this test. So here was where we marked that the dullness occurred, and we're going to ask the patient to just take a deep breath, and then I'm going to Okay, and then I heard resonance right here. And right here. And so I would just measure that area. And then this area should be about 3 to 5 centimeters, and this one measures about at 4. And now I'm just going to auscultate the lung fields. Could you inhale for me? And then exhale. Inhale. And at this point, if I thought the patient had pneumonia or I noticed wheezing, I would perform a series of tests, and one of them is the bronchoscopy test. And here I'm just going to ask the patient, I'm going to ask him to say 99, and I would listen to the lung sounds again and make sure that I cannot, make sure that it's muffled whenever he says 99. And if it was clearly heard, then that would mean that there's consolidation in the lung fields. Whenever I hit, when you feel me touch your back, will you please say 99?
Yeah. 99. 99. 99. 99. 99. 99. 99. 99. 99.
And then there's an EGOFI. That's another test that you can perform. And this one, I would ask the patient to say the letter E. And if I hear an A sound, that means there is consolidation in the lungs, and we might suspect pneumonia. Whenever I hit your back, they say the letter E.
Okay. E. 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 E.
And then now I'm going to perform the whisper. Pectopui. Anyways, this is where they whisper, and they whisper 1, 2, and 3, and you should not be able to hear. If you're able to clearly hear, if you are able to clearly hear the 1, 2, 3 as he is whispering, then that is another sign of consolidation. And so if you could just whisper the numbers 1, 2, 3 whenever I hit your chest. Then you feel me touch your chest. And I didn't hear anything. And so this will complete the respiratory examination.